you've been to Gaza, you can't stop going back. It's a very beautiful place. I've got people who I call family out there now, and when they can get out and they come and visit us. But I now know a new Gaza that I've witnessed in the last 2 or 3 weeks. And I thought I'd be ready for what I was going to see out there over the last 2 or 3 weeks. I have operated in the hospitals. I've been there on many, many occasions. Since October the 7th, I had spoken almost daily or WhatsApped daily friends and colleagues, nurses, doctors who work in the healthcare system there, and they told me how awful it was. And you've all seen how awful it's been. And I thought I was ready for what I was going to see, but I can tell you that nothing had prepared me and my colleagues for what we were going to see over there. What you're hearing about, what's being reported by the media over here, is really hardly touching the surface of what's really going on out there. And it was the worst thing I've ever experienced in 30 years of providing healthcare. I was at Al-Aqsa Hospital. I'm just going to tell you a little bit about it, and I'm really keen to take questions and answer anything you want to talk about. Al-Aqsa Hospital is a small hospital by Gazan standards. It has about 160 beds, I think. It was the only functioning hospital in Middle Gaza. And bear in mind that everywhere north of Middle Gaza, Gaza City and northern Gaza has got no functioning hospital at all. Shifa's just beginning to rise again, but effectively no functioning medical system at all north of where we were. And many hundreds of thousands of people had been displaced and were living in a variety of camps around Deir al-Balah, which is in Middle Gaza. So the hospital, which was meant to supply service for the population, was serving suddenly a much, much greater population, 3 of which were temporary camps near the hospital. And they were under constant bombardment day and night by the Israeli Defence Force while we were there. And the small hospital that normally had about 150 people had probably about 800 people when we were there, 800 patients. In the hospital and in the immediate surrounding areas, there were about 20,000 people. So the patients, their relatives, many people have migrated to the hospital because they perceive it to be a safe place, and it might be safer than the camps they were coming from, but as we all know, they're not safe places, hospitals, because they're being targeted over there. We saw many hundreds of people coming in every day from predominantly aerial bombardment, the most appalling injuries I'd ever dreamt I might see. In the emergency department at Al-Aqsa Hospital, most of the times there were maybe 2 or 3 doctors plus 2 of our team dealing with sometimes hundreds of admissions. I don't know how many of you got any medical or healthcare backgrounds. I'm sure you'll all be familiar with the term of triage, which is a sort of prioritisation process to deal with emergencies and to prioritise who's the sickest, who gets treated first. And it's a really fundamental way of treating any group of patients who are ill to any degree. And because there were so few doctors and so few nurses in Al-Aqsa Hospital, the whole triage process had collapsed. There was no triage at all. They were incapable of dealing with the dozens upon dozens of bomb victims that suddenly would arrive at the hospital. So it was like hell on earth. It was appalling in there. We saw these injuries of small children who came in with the most appalling burns that you knew they had no chance of surviving, but they were still alive, but they had no chance of surviving because their injuries were so bad. There was often no pain relief to give them. Many, many children, many young adults coming in with traumatic amputations, arms, legs amputated by the bombs, and of course multiple patients with severe shrapnel injuries. So I don't want to describe them in too much detail because it was very disturbing for us as healthcare professionals, but it's really pretty horrible for everyone else to hear about. But the healthcare system was completely overwhelmed at Al-Aqsa Hospital. We were there for 2 weeks. We had to leave 2 days before we did because it was when I was operating one day, there was a missile attack on the intensive care unit of Al-Aqsa Hospital, and all foreign doctors were immediately withdrawn, and we were not allowed to go back by the Israeli Defence Force. So that hospital is now become largely disabled. There is no functioning hospital really in Middle Gaza, so the only remaining hospitals are the two main hospitals in Khan Yunis, the European Hospital of Gaza and Nasser Medical Complex. In the last 2 or 3 days, Nasser Hospital has been completely surrounded by the Israeli Defence Force. Patients can't get to it. Doctors and nurses are rapidly leaving. So that is barely functioning now, which leaves the European hospital as the only functioning hospital in Gaza, other than in Rafah, which has got one very small hospital. So the healthcare system has been virtually completely disabled. I've witnessed this. There's incontrovertible evidence now that the healthcare structure, the buildings, the doctors, the nurses, the paramedics, the ambulances are all being deliberately targeted by the Israeli Defence Force with the clear aim of totally disabling the healthcare system there. It's been, when I first used to give this talk a few weeks ago, before I got out there, I would say it's on its knees. It's well past being on its knees now. It is virtually completely disabled. And unless there is a permanent ceasefire immediately, the healthcare system will be completely disabled. Now, I'm going to finish up before I take any questions, just by mentioning, you'll all be very familiar with the term excess deaths from the COVID pandemic. And I want to tell you about excess deaths in Gaza. So that 25,000 people who've been killed are those that have been killed immediately by bombs or the ground forces. It doesn't include those who die a week later from sepsis on the wards. It doesn't include any of those who are dying of other disorders. Now, the hospitals are completely overwhelmed with trauma victims. They cannot admit people with heart attacks or strokes or complications of diabetes or kidney failure or cancer. I'm a cancer surgeon. I've been spending years in Gaza trying to help improve their cancer services. They cannot treat cancer patients now. The communicable diseases, the infectious diseases, there's been 250,000 of acute respiratory tract infections in the last few weeks. 125,000 acute diarrheal illnesses due to infectious gastroenteritis. Something like 25,000, I think, cases of hepatitis A. And these diseases are escalating in frequency so much now that the excess deaths are going to kill far, far more than that 25,000 number that we've talked about. And that includes 13,000 children, by the way. So it's been estimated the excess deaths in Gaza is likely to get to 100,000, which is, getting on for well over 5% of the population of Gaza. So the healthcare system it has collapsed. The death rate is utterly appalling. There's 136 children dying per day in Gaza. In Ukraine, it's 0.7. It was in Syria. It was 2 children per day. The rate of killing in Gaza is 15 times greater than it has been in Ukraine over the last 18 months. And yet it's been ignored by the media, it's being ignored effectively by our government, by the US government. And this notion that a humanitarian pause can make a difference is a ludicrous concept in my view. We saw the aid trucks queuing up outside Rafah when we drove up to the border. There were probably 300 or 400 trucks waiting to get in there, mile upon mile of trucks queuing. They were waiting there sometimes for 3, 4, 5 days. We saw many being turned away. We saw one big articulated lorry full of diapers being turned away. You go into the shelters there, what haven't they got? They've got no diapers. They've got no sanitary pads for all women living there. And yet these trucks with these products were being turned away. When they get into Gaza, the trucks can't go anywhere because the ground forces are occupying all the main roads. So the aid cannot be distributed. So the humanitarian cause that our politicians are talking about will not make a jot of difference. The only thing that will make a difference is a permanent ceasefire, as we all hear now. Now I'm going to stop talking. I'd love to take any questions, because there may be things you want to hear about that I haven't mentioned.
Nick, thanks so much for your work. It's very inspiring. Can I just ask, we've heard lots about the situation in terms of anaesthetics and analgesia. Would you just be able to give your, and of course it's always rubbish in the press as if it's not really not happening. I'd love to know your first-hand experience, please.
Yeah, so we have many days, we had many days when there was no morphine at all in the hospital, no strong painkillers. So there's kids coming in with appalling burns down to the bone, or traumatic amputations, or horrendous chest or abdominal shrapnel injuries, no pain relief you could give them at all on some days. We always had enough anaesthetic in theatres to anaesthetise the patients, but on one day there was no running water in theatres or in the hospital at all, so we couldn't scrub up. The only way we could scrub up was using alcohol gel. On another day there were no sterile drapes for theatres, so we had to make our own sterile drapes from gowns. The instruments for operating were really, really limited, so we had to sort of make do with what we had there. You couldn't choose what sutures you wanted, you just had to use whatever they could find. So the equipment was really lacking. There were very few antibiotics. They occasionally came up with some antibiotics, but I mean, as you can imagine, the infections we saw were just absolutely terrible. So, and there were amputations being done without anaesthetic. We saw that. These were people whose limbs were half hanging off anyway, and were in the ED, the amputations were continued without any anaesthetic. So, and there were many people we saw who, in any other healthcare setting, would have been saved, but couldn't be saved because of the water. So it was far, far worse than I had ever imagined it could be.
Any more questions?
Yeah, you just got the how difficult or how easy access for getting medical personnel into Gaza to help out, because I think I know for a fact a lot of people desperate and wanting to go and help. I'm medical myself, so I don't know how you manage and what is the situation.
So it's difficult, and it's very clear to us that the Israelis do not want any foreign healthcare workers to go in there. It took Matt several weeks to negotiate. We were the first UK team that went in. There was another team of orthopaedic surgeons went in at the same time from the UK. MSF have been in there for a few weeks, but have been forced to withdraw from all the hospitals now, bar one. We were there for 2 weeks. When we left, another team from Matt, another team of UK surgeons replaced us. We've been living in a house in Al-Mawasi, which is sort of west of Khan Yunis, a fairly remote area. It had been chosen for us because there were no surrounding buildings. So it was really one building in a sort of a big open area, a safe area. Last Friday, while the 4 surgeons who had replaced me and my team were there, it was bombed by the Israelis. It cannot have been a mistake. It was the only building in that area. Luckily, no one was killed. They were injured with shrapnel, but no serious injuries, and they were immediately evacuated. So MAP has now suspended its further trips in there because this was a direct attack on foreign healthcare workers with a very clear view of killing them. So I've worked very much with MAP, so we're now planning on when we can resurrect that. That is being discussed at the highest levels between our government and the Israeli government, but the Israelis are refusing to back down at the moment. So it's a long-winded answer. I think the best way for any UK-based medics to get in there is with medical aid for Palestinians. So if you go on their website, they're wonderful, wonderful charity. And they've got a truly inspirational group of MAP staff on the ground in Gaza, who are one of the greatest groups of people I've ever met in my life, and they look after them very well. So go through MAP, and they're looking for many, many volunteers, they really are. Not just now, pre-ceasefire, but also for years. If there is a Gaza to rebuild, in years to come, there will be a need for volunteers to come out from the UK for years to come, and they will need everyone and every type of specialty. So I would recommend that.
Just one last question quickly.
I just wanted to ask about the seniority of doctors helping. Would it be useful for junior doctors to also help, or do you think should only be consultants?
No, I think definitely junior doctors. So one of the team that came out with me was an SD5, 6 A&E doctor who was just fantastic. So traditionally, MAP has always taken people who've been consultants, usually for a few years standing, but I think I was about to say they're desperate, I don't really like that. I mean, I think, no, absolutely. I mean, I think probably core trainees, SD1s might be a bit too junior, but if you're halfway through your special training, absolutely, I think you could be of huge benefit.